Hey guys, this week we're going to talk about Chapter 8, which is Skin Disorders and Diseases. It's one of my favorite chapters to teach, believe it or not. Alright, so some learning objectives, so some things you're going to be learning. You're going to learn how to identify and describe common skin lesions. This is going to talk about primary and secondary lesions. You're going to be able to list and describe some common disorders of the sebaceous glands. List and describe some common changes in skin pigmentation. You're going to be able to identify the forms of skin cancer, including symptoms and also mortality rates. You're going to be able to identify and describe the major causes of acne and current treatments that are available. So why do I need to study disorders and diseases of the skin? So providing even the most basic of skincare services require an understanding of underlying structure of the skin and common skin problems. Even something as small as waxing or a basic facial, you need to understand the skin. The ability to recognize skin disorders and know when the client should be referred for medical treatment or when they can be actually treated by a cosmetologist. Being fully qualified to offer skincare treatments adds another dimension of service for your clients. And that's what I want you guys to have. When you leave us, I want you guys to be able to do hair, skin, nails, whatever you desire. I want you to be able to take it further. If skin is what you want to do, get those continuing education classes. Maybe get certified in microderm or microblading, lash extensions, brow lamination, airbrush makeup, all of those things, but that requires an understanding of the skin. And along with that is its disorders and diseases. You're also going to be able to list the factors that contribute to the aging of the skin. You're going to be able to explain the effects of exposure to the sun on the skin. You're going to be able to describe contact dermatitis and prevention measures for cosmetologists. Okay, so skin is the largest organ of the body. We learned that in Chapter 7, and it is vital to our very existence. While it is designed to protect us, it also is the most visible organ of the body, and healthy skin is often associated with good health in general. Choosing a career in skincare to help people achieve maximum skin health and overcome or reduce the effects of skin disorders can be very rewarding. Skincare specialists are in high demand in many salons and spas and earn excellent salaries. Some stylists find caring for the skin less and physically demanding than styling hair and choose to balance their day by scheduling services in both areas. Personally, for myself, I have been behind the chair for over 17 years, and I would actually like to step away from hair, and I would like to learn more about skin, and I want to get those certifications. I'm to the point in my life I feel like I'm more zen. I feel like it's more of a relaxed clientele. I'm very interested at this point in my life in learning more. Skincare is an area of rapid change and growth, and the topic on most of the clients' minds. Knowing the basics of skincare and how the skin functions will allow you to advise clients on their skincare regimens when they seek your professional opinion. And this is no different, guys. If you think about just, have you ever been into Ulta? You go to Ulta, you get makeup, you get hair products, you get skincare products. You're spending a lot of money in places like that, Sephora, wherever it may be. Why not do that with your stylist or your esthetician or your cosmetologist? You could do the same thing. You have to let these clients know about the products, what kind of regimens they should be using for their skin type, and upsell your own ticket. There's no reason you shouldn't be bringing in that money versus a corporation like Ulta, for example. Okay, so let's talk about identifying the disorders and diseases of the skin. The skin is susceptible to a variety of diseases and disorders and ailments. In your work as a practitioner, you will often see skin and scalp disorders. So you must be prepared to recognize certain common skin conditions and know which you can help to treat and which must be referred to a physician or a dermatologist. It is very important that a salon not serve a client who is suffering from an inflamed skin disorder, infectious or not, without a physician's note permitting the client to receive services. So we learned in Chapter 7 what a dermatologist is, but just as a refresher, a dermatologist is a physician who specializes in the diseases and disorders of skin, hair, and nails. Okay? Okay, let's move on to talking about lesions of the skin. What is a lesion? A lesion is a mark on the skin that may indicate an injury or damage that changes the structure of tissues or organs. Next up, we're going to talk about some primary lesions of the skin. Your book has excellent photos of these. You can also Google photos of these. Primary lesions. So what does that mean? Primary lesions, that they are a different color than the color of the skin. They are raised above the surface of the skin. They often are differentiated by size and layers of the skin. These also may refer medical attention. Okay, so the first one we have up is a bulla. Okay, that is another word for a blister. A blister that contains a watery fluid similar to a vesicle but larger. It requires medical referral. The second you see here is a cyst. A cyst is a closed, abnormally developed sac containing fluid pus, semi-fluid, or morbid matter above or below the skin. It also requires medical referral. Next up, we have a picture of a macule. A macule is a flat spot or a discoloration on the skin. A nodule. That is a solid bump larger than 0.4 inches that can be easily felt. It also requires a medical referral. More primary lesions include a papule. Okay, this is also known as a pimple. It is a small elevation on the skin that contains no fluid but may develop pus. Next up, we have a tumor. A tumor is an abnormal mass that may vary in size, shape, and color. Any type of abnormal mass, not always cancer, requires a medical referral. Another primary lesion that we do not have is a vesicle. That is a small blister or a sac containing clear fluid lying with or just beneath the epidermis. This also requires a medical referral if the cause is unknown or untreatable with over-the-counter products. Okay, then we have a pustule. This is a raised, inflamed pimple. It usually has white or yellow center. This contains pus on top of the lesion. Pus usually means infection. There's my vesicle. And last but not least of the primary lesions is the wheal. A wheal is an itchy, swollen lesion that can be caused by a blow, a scratch, a bite of an insect, a skin allergy, or a sting. Typically resolves on its own, but a referral to a physician should be considered when the condition lasts more than 3 days. Okay, so secondary lesions. What is a secondary lesion? A secondary lesion are characterized by piles of material on the skin surface, such as a crust or a scab, or by a depression in the skin surface, such as an ulcer. So let's talk about some of the secondary lesions. First up, you're going to see a crust. A crust that is a dead cells that form over a wound or a blemish while healing. Accumulation of sebum and pus, sometimes mixed with epidermal cells. Next up, we have an excoriation. That is a skin sore or abrasion produced by usually scratching or scraping. Then we have a fissure. This is a crack in the skin. It usually penetrates into the dermis. Next up, you see a keloid. That is a thick scar. It usually results from excessive growth of fibrous tissues. Keloids will form along any type of scar for people that are susceptible to them. A scale. A scale is a thin, dry, or oily plate of the epidermal flake. An example of this is dandruff or excessive dandruff, seborrhea. Next up, we have a scar. This is a slightly raised mark on the skin formed after an injury or lesion of the skin has healed. Then we have an ulcer. An ulcer is an open lesion on the skin or the mucous membrane of the body. This is usually accompanied by the loss of skin depth and possibly weeping of fluid or pus. This requires a medical referral, particularly in clients with underlying medical conditions such as diabetes. Again, before I move on, let's talk about the client consultation card. That is why it is so important, no matter what service you're doing, to have that client consultation card and to go over it with your client before you even begin the service. Okay, so we're moving on. So now we are going to talk about identifying disorders of the sebaceous glands. We learned in Chapter 7, sebaceous glands is another word for an oil gland. Okay, so let's talk about blackheads first. We learned last chapter that a blackhead is a hair follicle filled with keratin and sebum. It becomes very hard. These are typically found in the T-zone, the center of your face. When it's exposed to the environment and it oxidizes, it turns black. Okay, we also talked about whiteheads. That is when the follicle is closed and not exposed to the environment. The sebum remains white or cream colored and appears as a small bump just under the skin surface, also known as a whitehead. So they're basically the same thing. One is just open and exposed to the environment, therefore it becomes dirty and gets dark, and so it's known as a blackhead versus a whitehead. So amelia, these are benign. They are keratin-filled cysts that appear just under the epidermis and have no visible opening. They resemble small round sesame seeds. I find that as I get older, you can't tell that I have them when I have on makeup, but I am finding them more as I get older. Using something like a face scrub or an exfoliator weekly or daily if it's not harsh, this has really helped me get rid of those melias. So let's talk about acne. Acne is a skin disorder that is characterized by chronic inflammation of the sebaceous glands from retained secretions and bacteria. The scientific term for acne or bacteria is also listed in your book. It's found on page 178. So what is a sebaceous cyst? Okay, a sebaceous cyst is a large protruding pocket-like lesion filled with sebum. Sebaceous cysts are frequently seen on the scalp and the back and may be surgically removed by a dermatologist. Seborrheic dermatitis. It is a skin condition caused by inflammation of the sebaceous glands, often characterized by inflammation, dry or oily scaling or crusting, and itchiness. Red, flaky skin often appears in the eyebrows, in the scalp, in the hairline, in the middle of the forehead, or along the sides of the nose. A dermatologist will prescribe a topical antifungal medication. In the salon, a non-fatty skincare product designed for sensitive skin can be used. Rosacea. Rosacea is a chronic condition that appears on the cheeks and the nose, characterized by redness because it's a dilation of blood vessels and formation of papules and pustules. Factors that aggravate rosacea are spicy food, caffeine, alcohol, exposure to extreme heat and cold or sunlight, and also stress. And guys, it's not that these are very uncommon. Most of your clients are going to have something. So these are very, very common actually, majority of them. Let's talk about the disorders of the sudiferous glands. We learned in chapter 7 that our sudiferous glands are our sweat glands. Okay, so let's talk about anhidrosis. Okay, this is the lack of perspiration. It is a deficiency or inability to sweat, often a result of damage to the autonomic nerves. This condition can be life-threatening and requires medical attention. Again, I told you for chapter 7 that everything you put in your body has to come out. That is why if this gets clogged, it could be life-threatening for you. Bromidrosis. This is foul-smelling perspiration. So body odor, basically. It is usually noticeable in the armpits or on the feet and is generally caused by bacteria. Sometimes this can need a medical referral as well. Hyperhidrosis. This means you sweat too much. Okay? It's caused by heat or general body weakness. It requires a medical referral as well. Then you have miliaria rubra. This is also called prickly heat. It is an acute inflammatory disorder characterized by an eruption of small red vesicles and accompanied by burning and itching caused by exposure to excessive heat. Okay. So let's talk about some inflammations and common infections of the skin. These are very, very common. Okay. Conjunctivitis. This is also known as pink eye, which is very contagious. It is a common bacterial infection of the eye, extremely contagious. It should absolutely be referred to a physician. Discard any products or implements that have touched the infected eye. Dermatitis. This is a term broadly used to describe any inflammatory condition of the skin. Eczema. This is an inflammatory, it is very uncomfortable and often chronic disease of the skin. It is characterized by moderate to severe inflammation, scaling, and sometimes severe itching. Herpes simplex. This is also known as fever blisters. As you know, this is a viral infection. It often presents itself as a fever blister or a cold sore, although many people have absolutely no symptoms. It is characterized by the eruption of a single vesicle or a group of vesicles on a red swollen base. The blisters are going to appear on the lips, nostrils, or other parts of the face, and sores can last up to 3 weeks. Herpes simplex 2 is caused by the same virus, and it is designated as type 2 because it occurs below the waist. It is contagious and it requires a medical referral. Drugs are now available to control the symptoms, but the virus will always remain in your body if you're infected. Impetigo. It is a contagious bacterial skin infection characterized by weeping lesions and usually caused by a Staphylococcus bacteria. It normally occurs on the face, especially around the nasal passages, and is most frequently seen in children, although it is possible at any age. Psoriasis. This is a skin disease that is characterized by red patches covered with silver and white scales and is usually found on the scalp, elbows, knees, chest, and lower back. It is rarely found on the face. Psoriasis is caused by skin cells turning over faster than normal, and when the condition is irritated, bleeding points can occur. Psoriasis is not contagious, but it requires medical referral. It is treatable, but it is not curable. So, recognizing pigment disorders of the skin. Pigment can be affected by internal factors such as hereditary or hormonal fluctuations, by external factors such as prolonged exposure to the sun, abnormal colorations known as dyscharismias accompany skin disorders and are symptoms of many of the systemic disorders. Okay, so let's talk about the first one, hyperpigmentation. What is that? Hyperpigmentation means darker than normal pigment in splotches. So these are dark spots, basically. Hypopigmentation. This is the absence of pigment, resulting in light or white splotches throughout your body. Albinism. This is a congenital, which means from birth, hypopigmentation, or absence of melanin pigment of the body, skin, hair, and eyes. So either the person has absolutely no melanin, like the picture that you're looking at in this slide, or they have quite a bit of hypopigmentations, lighter spots. Chloasma. This is a condition characterized by hyperpigmentation on the skin in spots that are not elevated. These are generally caused by sun exposure and can be helped by exfoliation or can be treated by a dermatologist. We also have really good technology now in our med spas. We use lasers, we use microneedling, microdermabrasion. Any of those treatments would help this as well. Again, a med spa, you're going to have to see an esthetician. They typically work under a nurse and can administer these treatments. Okay, so next up we have lentigines. Okay, this is the technical term for freckles. Freckles are small yellow colored to brown colored spots on the skin exposed to sunlight and air. It is also commonly referred to as liver spots in older adults, although there is no relationship to the liver. Leukodermia. It is a skin disorder characterized by light, abnormal patches. This is the hypopigmentation. It is caused by a burn, a scar, inflammation, a congenital disease, which means from birth, that destroys the pigment-producing cells. A nevus. This is also known as your birthmark. It is a small or large malformation of the skin due to abnormal pigmentation or dilated capillaries. Just a few more. So next up we have a stain. A stain is an abnormal brown or red patch having a circular or irregular shape occurring during aging, after certain diseases, and after disappearance of moles, freckles, and liver spots. A tan. We all know what a tan is. We all like a good tan. I just like a safe tan. A tan is the change of pigmentation of the skin caused by exposure to the sun or an ultraviolet light. When they say an ultraviolet light, they mean like a tanning bed. Vitiligo, okay? It is a hereditary condition that causes hypopigmented spots and splotches on the skin that often appear milky white. Skin with vitiligo must be protected from overexposure to the sun. Okay, let's talk about hypertrophies of the skin. But first up, what is a hypertrophy? This is an abnormal growth of the skin. Some are very benign or harmless. So when I say benign, that means non-cancerous. Okay, the first one we're going to talk about is a keratoma, which is also known as a callus. It is acquired superficial, round, thickened patch of the epidermis due to pressure or friction on the hands of the feet. If it grows inward into your skin, it's called a corn. A mole. It is a small brown spot or blemish on the skin, ranging in color from pale tan to brown or even bluish black. Some moles are small and flat, resembling freckles. Others are raised and darker in color. Large dark hairs often occur in moles. Any change in a mole needs to require medical attention sooner than later. A skin tag. A skin tag is a small brown or flesh-colored outgrowth of the skin. These most frequently occur on the neck and the chest. You can go to the dermatologist. They typically freeze these off. A verruca. It is also known as a wart. That is a hypertrophy of the papillae and epidermis. It is caused by a virus, and it is infectious. A verruca can spread from one location to the other, particularly along a scratch of the skin. A dermatologist can be very helpful in removing and reducing the reoccurrence of warts. All right, so next up, we're going to talk a little bit about skin cancer, which is something that I'm very passionate about. I have had a lot of experience with skin cancer. My dad has had several of the basal cell carcinomas and squamous cell carcinomas, and he has had malignant melanoma, I think 13 or 14 different times inside and outside of his body. So I'm very passionate about this. This is why I choose not to stay in the sun. Outside of, I do not want to age. I spend a lot of money on my makeup and my skin care. And so if I am spending money on these treatments, I don't want to sit in the sun and reverse the treatments. But also, I don't do a lot of tanning and things like that because it's already going to be hereditary for me, most likely. So let's talk about some skin cancer. Basal cell carcinoma. It is the most common and least severe skin cancer, characterized by light or pearly nodules, and has a 90% survival rate with early diagnosis and treatment. Squamous cell carcinoma. It is more serious than basal cell. It is characterized by scaly red papules or nodules. It can spread to other parts of the body, and the survival rates depend on the stage at diagnosis. Typically, you're stage 1, stage 2, stage 3, stage 4 being the worst. So depending on what stage you're at, depends on your survival rate. Then we have malignant melanoma. This is the least common, but it is the most dangerous form of skin cancer. It is characterized by black or dark brown patches on the skin. They may appear uneven in texture, jagged, or raised. Malignant melanoma is the least common, but is 100% fatal if it is left untreated. Early detection and treatment can result in a 94% 5-year survival rate, but that drops drastically to 62% once it reaches local lymph nodes. So what that means, if it goes untreated or if you don't go get it taken care of, then it can kill you. It is 100% fatal. However, if you do, you have a big survival rate. However, if it goes into your lymph nodes, which it some kind can, your lymph nodes are typically located under your arms, your groin area, in your neck. If it gets in that, it can travel. Your lymph nodes will take it to another part of your body. So it's very scary. I can tell you like I said, my experience with my father, his very first one, when they caught it, was a stage 3 on his back. And so he had surgery to remove it. It was about 5 inches deep into his skin. It was a really big chunk. They found it because my mom had seen it and seen that it was changing, shapes, colors, the border. It just looked different. And so when they got there, they removed it. They did a skin graft, but you can still very much see where my dad had that surgery. He has had several more. They all look different. He has had them on his neck, his leg, his arm, his back, all over. And again, they look different. One in particular on his leg, he said it had been there since he was probably 15 years old, and they found it in his 50s. So it had been there a really long time before he had discovered it and before it had turned into skin cancer. So definitely do your routine skin checks, even on the parts of your bodies that you can't see. Have your spouse check you. I always recommend going to a dermatologist. I go once a year. If they find something, they'll have me come back in 6 months. Sometimes it's every 3 months for somebody like my dad who has been repetitive. So just keep that in mind. It is very, very scary. Okay. So client advice in regards to skin cancer. Clients should be advised to regularly see a dermatologist for checkups of the skin, especially if any changes in coloration, size, or shape of a mole are detected. If the skin bleeds unexpectedly or if a lesion or scrape does not heal quickly. You can do this by performing home self-exams. They can be an effective way to check for signs of potential skin cancer between scheduled doctor visits. When performing a self-care exam, clients should be advised to check for any changes in existing moles and pay attention to any new visible growths on the skin. I can say that throughout my years cutting hair, I had a client and she had something on her scalp. She came to me about every 8 weeks for a haircut. And from one haircut to the other, I noticed something on her scalp. So I went in and I told her, I can't tell her what I think it is or anything like that. Well, I told her. She did not go to the doctor. She come back to me 8 weeks later and it looked completely different. So I begged her to go to the doctor. I even called her mother and told her, you need to get her to the doctor. I don't know what's going on, but I don't like the way it looks. Well, she couldn't see it. Only I could see it. It was on her scalp. So sure enough, it turned out to be stage 4 malignant melanoma. Had she not been getting her hair cut, she would have never known. And it could have been very fatal for her. So also, this is why hair and scalp analysis is very, very important. Early detection of these skin cancers, cosmetologists, like I just said, serve a unique role by being able to recognize the appearance of a serious skin disorder and referring the client to a dermatologist for diagnosis and treatment. The ABCDE cancer checklist. So let's talk about this. When checking existing moles, look for changes in the areas. If changes in any of these areas are noted, consult a physician. For more information, contact the American Cancer Society at www.cancer.org. You're looking for asymmetry. So what this means is the mole or the mark on the skin, is it the same on both sides or is it different? Does it mirror each other or are they different? We're looking at the border. of this? Is it raised? Is it dark around the edges? We're looking at the color. Does it change in color? We're looking at the diameter of it. How big is it? How thick is it? And we're looking at evolving. Does it change? Okay, so let's move on talking about acne and also a little bit of problem skin in there. So we're examining acne and problem skin. Acne is both a skin disorder and an aesthetic problem. It is a major concern for anyone who suffers from it. It frequently is misunderstood to be a teenage skin disorder. It can affect people at almost any age. Women often do not have acne problems until they reach their 20s, 30s, or beyond. A predisposition to acne is based on heredity and also on hormones. And your diet. We learned that in the last chapter. Let's talk about retention hyperkeratosis. Okay, this is the hereditary tendency for acne-prone skin to retain dead cells in the follicle, forming an obstruction that clogs the follicles, causes inflammatory acne lesions such as papules and pustules. So basically what happens is your skin becomes clogged in that follicle, causing those pustules. Okay, the next up are the anaerobic acnes. Okay, these cannot survive in oxygen. Okay, when the follicles are obstructed, oxygen is blocked from the bottom of the follicles, allowing acne bacteria to multiply. The bacteria multiply, causing inflammation and swelling of the follicle and eventually rupture the follicle wall. Then we have an acne papule. This is an inflammatory acne lesion resulting from this wall rupture and infusion of the blood. A pustule forms from the papule when enough white blood cells accumulate from pus, which is primarily composed of dead white blood cells. So let's talk about acne treatment. How can we treat it? Minor forms of acne can be treated without medical referral. This is where we can step in. We can upsell our tickets. We can bring in money as far as products for skincare regimens and that sort of thing. So let's talk about cleansers. Cleansers are a daily use of gentle formulated for a particular specific skin type. These are foamy, they rinse off products, remove dirt, debris, and excess from oil from the skin. They do, I know it says they're foamy, but they come in several different types. They can be cream, they can be gel-like, several different forms now. Follicle exfoliants. These are leave-on products that help remove cell buildup from the follicle, allowing oxygen to penetrate the follicle, killing the bacteria. Commonly used ingredients in the products are alpha hydroxy acid, salicylic acid, and benzoyl peroxide. These are generally only used as a spot treatment, which means they're just used on the acne spots. Avoidance of any fatty skincare and cosmetic products. Products that contain large amounts of fatty materials and oils can cause follicles to clog from the outside. Make sure all makeup and skincare products used on acne-prone skin are non-comedogenic, which means the product has been designed and proven not to clog the follicles. Then you're going to need a light moisturizer. It can help keep the skin balanced and reduce the risk of excess sebum production, and that can be very helpful. So analyzing aging skin issues. So none of us like to get older, but let's talk about, as we get older, analyzing those issues. Aging of the skin is a concern for almost every client that is over 30 years old and has become a major area for new services and retail revenue within the salon and spa environment. There are two types of factors that influence aging of the skin: intrinsic factors and extrinsic factors. So let's talk about intrinsic factors first. This is skin aging factors over which we have very little control. This includes our genetics, our ethnicity, gravity, life, facial expressions, okay? Extrinsic factors are primarily environmental factors that contribute to aging and the appearance of aging. Many scientists and dermatologists believe that intrinsic factors are responsible for up to 85% of skin aging. So let's talk about one, exposure to the sun. Tanning and sunbathing are significant offenders in the prevention of both aging and cancers of the skin, and should always be discouraged by skincare professionals. Let's talk about smoking. Smoking produces tremendous numbers of free radicals, which are unstable molecules that cause biochemical aging. These molecules over time can have a devastating effect on the body, causing wrinkling, sagging of the skin, particularly around the face and neck. Overuse of alcohol. Alcohol use inhibits the body from repairing itself and interferes with proper nutrition distribution to the skin and body tissues. Smoking and drinking together. The constant dilation of the contraction that occur on a tiny capillary and blood vessel, as well as the constant deprivation of oxygen and water to the tissues, quickly make the skin appear lifeless and dull. Stress. Stress plays a significant role in the overall health and contributes to premature aging of all organs, including the skin. Research now confirms that stress causes biochemical changes at the cellular level that can lead to tissue damage that we call aging. So stress ages you. Poor nutrition. Poor nutrition deprives the skin of the proteins, fats, carbohydrates, vitamins, and minerals that are required to maintain, protect, and repair the skin, keeping that young and beautiful look. Eating a well-balanced diet allows for all body systems to function at a maximum performance and nourish the fragile tissues of the skin. Exposure to pollution. Pollution also produces free radicals and interferes with proper oxygen consumption. So let's talk about the sun and its effects. The sun's ultraviolet rays have the greatest impact on how our skin ages. This is mind-blowing to me. Approximately 80 to 85% of the symptoms of aging skincare are caused by the accumulation of damaging rays from the sun as we age. The collagen and elastin fibers of the skin naturally weaken, and this weakening happens at a much faster rate when the skin is frequently exposed to UV light without proper protection. UVA rays, what are they? They are also called aging rays, and that's how I remember them. UV and the A stands for aging. Deep penetrating, they weaken the collagen and elastin. They cause wrinkles, sagging. UVB rays, also called burning rays. Again, I remember that because of the B. They cause sunburn and tanning of the skin by affecting the melanin. These rays are not as deep as UVA, but are equally damaging to the skin and eyes. They do, however, contribute to the body's synthesis of vitamin D. So actually bringing in that vitamin D. So we need UVB. We just cannot overuse UVB rays. So let's talk about protection from the sun. Avoid exposure, deliberate exposure, which means staying out there all day from sun up to sundown, not putting any sunscreen on. Again, we talked about this in chapter 7. You want to use a broad spectrum sunscreen. It filters both UVA and UVB rays. At least 15 on a daily basis. I use 15 on my face every day. A lot of these are built into makeup now. And also when I go out, like if I am going to the pool or to the beach or something like that, I use really high, like 50 to 70 on my face and my neck. Everywhere else, I use like 30 SPF, but I use really high on my face and my neck. Avoiding prolonged exposure, especially during peak hours. So peak hours of the sun is considered to be 10 a.m. to 3 p.m. So maybe not staying out there the whole time, but kind of taking breaks in between. Apply your sunscreen liberally. Okay. Apply 30 minutes prior before going out. Apply sunscreen after swimming, after activities, and this will result in heavy perspiration as well. And also, guys, follow your manufacturer's directions for whatever your sunscreen is. Avoid exposing children under 6 months old. Wear a hat and protective clothing. People who are prone to burning frequently and easy should wear a hat and protective clothing when participating in outdoor activities, in addition to using sunscreen. So we talked about this earlier, but not a lot. I just introduced you to what dermatitis was. But we're going to talk about contact dermatitis because this is something that is very common among stylists, estheticians, anybody really in our field. Contact dermatitis is an inflammation of the skin caused by having contact with certain chemicals and substances. Okay, so let's talk about allergic contact dermatitis. This happens or occurs when a person develops an allergy to an ingredient or to a chemical, usually caused by repeated skin contact with a chemical. Let me give you an example. I used to work with a lady, and she had been a stylist for over 20 years. I kept getting a rash on her arms, and she had become allergic to her gloves. She wore like the reusable gloves that you could sanitize and all of that, clean and sanitize, and she was getting contact dermatitis from that. And it's, she hadn't always had it for 20 years, but she had actually gained that throughout her time. Sensitization. Okay, this is an allergic reaction caused by repeated exposure to that chemical or the substance. Common places for allergic contact dermatitis are listed below. So, and I have these listed on the slide. The fingers, the palms, are on the back of the hand, the face, especially on the cheeks, the scalp, the hairline, the forehead, and the neckline. Contact dermatitis, you see this a lot in barbershops where they are not cleaning their implements on their clippers. When they do a man's haircut, I know you have seen a man that has little bumps around his hairline. He's real red right after he gets his haircut. That is because the barber or the stylist is not cleaning their implements. And it's irritating them. It's causing them contact dermatitis. So that brings us to irritant contact dermatitis. This occurs when irritating substances temporarily damage the epidermis. Corrosive substances or exfoliating agents are examples of products with an irritant potential. Contact with irritant chemicals can cause damage to the epidermis because the irritant can enter the skin surface and cause possible inflammation, redness, swelling, itching, and burning, and repeated exposure can worsen the condition. This is what I was talking about a while ago with sensitization. Contact dermatitis. So let's talk about protecting yourself. Take time to keep implements, tools, equipment, and surfaces clean and disinfected. You guys know this in your sleep. You know how to do beginning, end of the day, in between each client. You know how to clean that station, disinfect that station. You know how to clean your implements, disinfect those implements. You need to do this. I cannot stress how important it is once you leave us and go to a salon. You have the liability is all on you. Right now, the liability is on the college. However, the liability is going to be all on you, and that can be a scary thing. Changing your capes, using neck strips, and I see it all the time. You get busy in the salon, and you're like, well, I'll just clean it at the end of the day. Or use the same cape on a client. Guys, please watch yourself with that. Keep tools and surroundings clean. Use proper disinfection of brush handles, containers, surfaces, all of that. You can also wear protective gloves, and you should be doing this. Facials, waxing, color, any chemical, you guys know that. Always wear your protective gloves. Keep your hands clean, wash your hands. hand sanitizer it will get you by, but I prefer you to wash your hands with soap and water in between each client and throughout the day. So let's review a little bit. Okay. The skin is the largest organ on the body. It protects us from the environment, regulates the body temperature, and provides sensation. The skin can be affected quite easily, but most salon services. Therefore, it is important for cosmetologists to know what products can penetrate the skin and what effects that they will have on your clients. By learning to identify the various diseases and disorders of the skin, you will be able to provide more effective and safe services for your clients. That's what it's all about, guys, growing and taking these services and expanding your clientele. Don't just stick to, oh, I'm just going to do nails or I'm just going to do hair. Expand yourself. So let's do some review questions with a little bit of answers. I'm going to help you guys a little bit. Primary lesion, and list 3 types. A primary lesion is a different color than the other skin. It's raised above the surface of the skin. They are often differentiated by size and layers of the skin. You can have a bulla, a cyst, a macule, a nodule, a papule, a pustule, tubercle, a tumor, a vesicle, or a wheal. There are several of them. Okay, a secondary skin lesion. And let's list all of them too. I know it says 3 in the question, but I'm just reviewing. Secondary is characterized by piles of material on the skin, such as a crust or a scab or a depression in the skin. Examples are crust, excoriation, fissure, keloid, scale, scar, and ulcer. Name and describe at least 5 disorders of the sebaceous glands. You have blackheads, you have whiteheads, melia, acne, sebaceous cysts, seborrheic dermatitis, rosacea, all of those. The answer to that question can be found on 178 for in detailed for explanations of each one of those. Name and describe at least 5 changes of skin pigmentation. Albinism, chloasma, leukoderma, nevus, stains, tan, vitiligo. Again, page 180 and 181 has these in detail. Name and describe the 3 forms of skin cancer. You have basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. All 3 of these can be explained in great detail on page 182. What are the 2 major causes of acne and how should they be effectively treated? Hereditary and hormones. Okay, you can find how they should be treated on page 184. What is the most significant factor in aging of the skin and increasing risk of all types of skin cancer? The answer to this is sun exposure without protection, which is a big no-no. Explain the effect of overexposure to the sun on the skin. Okay, the UV rays are going to weaken your collagen and elastin. This is going to cause wrinkling, and this is going to cause sagging. It's going to make you look old, which we're all scared of. What is contact dermatitis and how can it be prevented? It is inflammation of the skin caused by having contact with certain chemicals and substances in cosmetology. It can be prevented by cleaning, disinfecting, wearing gloves, keeping your hands moisturized. I hope you guys learned a lot this lesson. You guys are going to take this, answer some questions, and then there are going to be some supporting activities that you will do to also continue your learning for Chapter 8. Thank you so much.